Most of us know that taking an aspirin a day helps prevent heart disease, but millions of Americans who could benefit from a low dose of the drug don't take it. A new University of Southern California study led by our own Dr. David Agus shows the impact if more people followed aspirin therapy recommendations. Over the next 20 years, 900,000 lives could be spared and $692 billion in health benefit costs saved. Dr. Agus joins us now from Los Angeles. Good morning.
Good morning, Nora.
Okay, so describe low-dose aspirin therapy.
So aspirin is a 2,000-year-old drug. You know, Hippocrates described it when he take the bark of the willow tree and chew it, pain and fever go away. But 81 milligrams of this compound every day reduces the death rate of cancer by 30%, heart disease by 22%, and stroke by 17%. And so certainly remarkable numbers. The problem is most of us aren't taking it. So we did a computer simulation study to show that if people took it, who should take it, do take it, you're going to add 900,000 lives by the year 2036, and the $690 billion in net health savings. Those are big numbers.
David, at what age should this start?
Anthony, age 50 is where the data are really most pronounced, because that's when disease starts to happen, heart disease and cancer. And so at age 50, some of the cancer studies started at age 40, which is where I started aspirin. But clearly at age 50. But have a talk with your doctor first before you start a medicine, but certainly interesting.
So if it's so good for us, especially for people over the age of 50, why aren't we taking it?
Well, Gail, I got to ask that question to you. I think that's the key question.
Busted! You are busted.
So busted. I wasn't referring to me, Dr. Agus. I'm asking for all the viewers out there.
Part of the reason is it's too cheap. Right? When you have a drug that costs several dollars a year, nobody's going to spend money marketing it. We don't perceive value in it, but the data are clearly there. When you talk about health reform, we talk about healthcare finance reform, this is real health reform. Let's educate people to take a pill that makes a benefit.
Any downside?
Well, it can increase bleeding time, and it can upset the stomach, both of which are real, and we figure them into our models, but the benefits dramatically outweigh the risks. Okay. So, Gail, start.
I am. I really am.
It's an important reminder. I'm glad to hear this, Dr. Agus. Let me ask you also about this other new sleep study that has just come out from the RAND Corporation, and it found that the lack of sleep costs the U.S. up to $411 billion in lost productivity. And what does it mean for us on the individual level?
Well, I think we as a culture are saying, we got to get more done, use your devices till right before you go to bed. And we forget that having a restful sleep actually makes us work better during the day. And so it hurts us. People who sleep less than 7 hours has a higher death rate, as well as the lack of productivity. And so from a health perspective, it's critical that you get that 7 hours.
David, I mean, we keep hearing these stories, but I mean, what are the signs, aside from getting up at 4 o'clock to do this show, what are the signs you're not getting enough sleep?
The key is to get regular sleep. Go to bed the same time and get up the same time in the morning. When you can't concentrate during the day, you can't focus, you're feeling fatigued, that's a sign of it. And, we're getting more overweight, which affects our sleep. We're drinking more of these sugary sodas. We're drinking caffeine, alcohol, all of which affect our sleep, and doing less exercise, all of which take time off sleep. And so we need to change our whole lifestyle, because the goal is a productivity, happy, and long life. And we can achieve it if we pay attention.
We all want those things, Dr.
I know.
We all want it. It's just difficult.
Gail, aspirin.
I know. I swear to God, I'm going to do that. I'm going to do that. I'm going to
All right, Dr. David Agus, thanks.